Aloha, my name is Brennan Buccat, and I worked on this presentation with my fellow classmates, Kiera Javillonar and Regalario. We are graduating in 2024 from the Daniel K. Inouye College of Pharmacy at the University of Hawaii at Hilo, and would like to talk to you about heart disease. By the end of our presentation, you will know the major types of heart disease, be able to identify risk factors, and understand treatment options. Please note that this presentation is meant for educational purposes only and should not be used as medical advice or as a means of diagnosis. You should contact your primary care doctor if you have any other questions. Heart disease is the leading cause of death for both men and women and many ethnic groups. In the United States alone, one person dies every 34 seconds as a result of heart disease. In 2020, $229 billion were spent on care for patients with heart disease. Though there are many types of heart disease, we'll be focusing on coronary artery disease and heart failure, which are more commonly seen and can have serious effects on your health. Coronary artery disease, or CAD, is the most common type of heart disease in the United States. The main cause of CAD is plaque buildup in the walls of the blood vessels that supply blood to the heart and other parts of the body. Plaque buildup, most commonly caused by too much cholesterol, causes the blood vessels to narrow over time and can lead to partial or total blockages. A blockage can prevent oxygen in the blood from getting to the heart or cause a piece of the cholesterol or plaque to move through the artery that goes to the heart and cause decreased blood flow. When blood that carries oxygen to the heart is blocked, the muscles in the heart don't get enough oxygen and start to die, which leads to a heart attack. Some of the most common symptoms of CAD include angina, also known as chest pain, shortness of breath, and fatigue. Another common type of heart disease is heart failure, which is a very serious condition. It happens when the heart is unable to pump enough blood, which carries oxygen to support the other organs. Common symptoms of heart failure are shortness of breath that can occur with normal activity, having trouble breathing while lying down, swelling in the feet and legs, which can cause sudden weight gain, and general tiredness and weakness. Now I'm going to talk about factors that may increase your chance of developing heart disease. There are certain factors that can increase our risk for developing heart disease. Some health conditions that increase the risk of developing heart disease include high blood pressure, diabetes, unhealthy blood cholesterol levels, and obesity, or being overweight, among others. High blood pressure, often called hypertension, causes the heart to work harder. Over time, this can damage the blood vessels and lead to more plaque buildup, which can lead to coronary artery disease. High blood pressure can also cause the muscles in the heart to thicken, which leads to heart failure. Diabetes is a condition where your body isn't able to produce enough insulin or use it well enough to remove sugar in the blood. This leads to high levels of sugar in the blood. When our sugar levels in the blood are high for a long period of time, it can damage the blood vessels and nerves that can control the heart. Having unhealthy blood cholesterol can lead to coronary artery disease. LDL, aka bad cholesterol, stick together in the blood vessels and can prevent blood from flowing properly. Therefore, having high LDL cholesterol can result in plaque buildup in the arteries in the heart, which can impair blood flow and prevent oxygen from getting to the heart. LDL cholesterol is like a clog in your drain pipe that causes water to drain slowly or sometimes not at all. In many cases, heart disease may be prevented, or the rate at which the disease progresses slows down by changes in our lifestyle, or changes in what we eat or physical activity. Factors that increase our risks for heart disease include having a diet high in saturated fats, trans fats, and cholesterol, not being active enough, drinking alcohol excessively, and smoking. We will discuss ways these behaviors can be adjusted to help lower your risk of developing heart disease. Now, I will talk about ways to help prevent heart disease by first making changes to your lifestyle. Our diet is a direct result of what we eat and can greatly affect the heart. A great way to keep a healthy diet is to limit foods that are high in saturated fats, including butter, eggs, and animal-based foods like beef, pork, and lamb. These foods don't need to be avoided, but should be enjoyed in moderation or small amounts. However, foods with trans fats, such as margarine or processed baked goods, should be avoided. To determine if foods have trans fats in them, look on the list of ingredients and avoid foods that contain an ingredient called partially hydrogenated oils. Fiber-rich and whole grain foods have been associated with better quality diets and a decreased risk of developing heart disease. Examples of whole grains are brown rice, oatmeal, or quinoa, which are all great sources of dietary fiber and can help lower cholesterol levels and decrease the risk of various diseases. It is also important to limit the amount of salt and sugar we eat to keep a healthy heart. Eating less sodium, which is most commonly found in salt, soy sauce, or fish sauce, will help to lower blood pressure, and eating less sugar will help to prevent excess weight gain. The American Heart Association recommends no more than 1 1/4 teaspoon or 2,400 milligrams of salt per day. But if you have high blood pressure, then limit of 2/3 teaspoon of salt or 1,500 milligrams of salt per day is recommended. A Big Mac from McDonald's contains 1,010 milligrams of sodium, which is nearly half the amount of salt you can eat in a day if you don't have high blood pressure. One serving of Spam, or 2 to 3 slices, contains about 770 milligrams of sodium, or about 1/3 of the amount of salt for someone who does not have high blood pressure can have in a day. And this does not include the amount of salt that would be added if you add shoyu or soy sauce on your Spam. Instead of using salt and soy sauce to add flavor to food, use herbs or spices like pepper, red pepper flakes, oregano, basil, or cumin. Foods with lots of sugar include soda, juice, candy bars, ice cream, cookies, and candy. The American Heart Association recommends that males consume 9 teaspoons or less of sugar per day, while females consume 6 teaspoons or less. For example, a 12-ounce can of soda contains 8 teaspoons of sugar. This means that if you drink 1 can of soda, this is the only sugar you can drink or eat in a day. To keep your heart healthy and prevent weight gain, Avoid soda, juice, candies, and other desserts. Instead, eat fruits in small portions, such as half an orange or apple, or a fistful size of cut melons, grapes, or berries throughout the day as a snack. Fruit has natural sugars, so it's important not to eat too much fruits at one time. Limiting alcohol consumption is an important lifestyle change that can make a huge impact on our health. It's recommended that men limit the amount of alcohol they drink to 2 drinks per day, and women 1 drink. The image at the bottom of the slide illustrates what 1 drink looks like. 12 ounces of regular beer, 8 to 9 ounces of malt liquor, 5 ounces of wine, or a 1.5-ounce shot of hard liquor, such as rum, tequila, vodka, or whiskey. Exercise is important to keep our heart and body healthy. The exercise goal is to get at least 150 minutes of moderate intensity exercise with 2 days of strength training a week. Examples of moderate intensity exercises include brisk walking, water aerobics, and biking on level ground or with few hills. Examples of strength or resistance training are climbing stairs, lifting weights at your own pace, or doing simple exercises while incorporating resistance bands. It's important to keep in mind that this is the optimal goal for exercise, and it's okay to start off slow and increase the time you spend exercising according to your lifestyle and tolerability. Smoking cigarettes or vaping greatly increases the risk of developing cancer in your lungs, mouth, and throat. It also has many negative consequences on the body, including making it difficult to conceive or have a baby, loss of teeth, breathing disorders such as chronic obstructive pulmonary disease or COPD, which causes chronic coughing, and many other problems. The picture of the heart has the many ways cigarette smoke damages the heart. Specifically on the heart, smoking causes damage to the blood vessels or arteries and makes them thicker and narrower, making it harder for blood to get to different parts of our body and increases blood pressure. The carbon monoxide that comes from smoking causes your heart to work harder and can reduce the ability for blood to carry oxygen. If you smoke and are thinking about quitting, ask your doctor or pharmacist about resources and medications that are available to help you quit. People who suffer from obesity or being overweight have a higher risk for heart disease, as having excess weight can put stress on the heart and blood vessels. Losing 5% of your weight can reduce blood pressure, cholesterol, and blood sugar levels. So if I weigh 200 pounds, I would have to lose about 10 pounds to reach that 5% weight loss. This weight loss should be achieved over time with no more than 1 pound a week and can be done by following the diet and exercise recommendations discussed earlier. It is very important that you take responsibility for your own health by working with your doctor to create a treatment plan that you can follow. If you have any questions about your medications, feel free to ask the pharmacist where you pick up your medications. By having a healthy diet and doing exercises that you enjoy, you'll be able to live a longer, healthier life with your loved ones. Having a healthy heart will allow you to continue playing outside with your children or grandchildren, travel to different parts of the world, and go on new adventures. Pharmacist, your primary care doctor, and your personal support network, such as your family, and friends are your biggest advocates, and we all want to see you live a long, healthy, and happy life. Now I will be talking about medications that may be recommended for someone who has a heart condition, such as congestive heart failure or coronary artery disease, that can help prevent progression of these diseases before starting any of these medications. Please speak with your doctor. Please note that we're highlighting the more common medications, and this isn't a complete list that your doctor may recommend. First, I will be talking about medications that are used if someone has coronary artery disease. Depending on the condition, someone may be on one or two of these types of medications to prevent platelets from sticking together and will help prevent blockages in the arteries. If you are on any of these medications, it increases your risk for bleeding. So it's important to tell your doctor if you have any signs of bleeding, such as stool that looks like coffee grounds, red color in your stool or urine, or bruises that continue to get bigger. If you hit your head or fall on your head, you should go to the emergency room to see if you have any bleeding in your brain. Cholesterol-lowering medications, often called statins, because they all have the names that end in statin, including atorvastatin or Lipitor, lovastatin or Altoprev, pravastatin or Pravachol, and rosuvastatin or Crestor. The purpose of the statin medications is to help lower bad cholesterol by preventing our body from making more of it. Common side effects include muscle pain. Please tell your doctor if you have muscle pain after starting this medication that does not improve or continues to worsen, and if you did not do any strenuous activities prior to the having of muscle pain. Drugs such as amlodipine or Norvasc are used to decrease the heart's pumping strength and relax the blood vessels. Common side effects include constipation, dizziness, and fatigue. Next, I'll be talking about medications that a person with heart failure may be on. There are medications that help to relax the blood vessels, which reduce pressure on the heart. There are a couple different classes of medications that do this, and are commonly called angiotensin-converting enzymes, or ACE inhibitors. Examples of these medications are lisinopril, enalapril, or ramipril. Another class of medications that also help to relax the blood vessels are angiotensin II receptor blockers, or ARBs, like losartan, valsartan, and candesartan. A person should only be on one medication from either class. Common side effects include a dry cough, which is more common with the ACE inhibitors such as lisinopril, enalapril, or ramipril. Another side effect, which is rare and occurs more often with ACE inhibitors, is an allergic reaction called angioedema, in which swelling occurs under your skin. Signs of angioedema include swelling of the lip and tongue or difficulty breathing. If you experience this, discontinue the medication, seek emergency medical attention by calling 911, and contact your doctor immediately. This is a very rare side effect, but it's important to be aware of the symptoms in case you have them. Beta blockers such as metoprolol, bisoprolol, atenolol, and propranolol decrease the heart rate and force of contraction, which results in lower blood pressure. Common side effects include feeling tired and dizziness. Diuretics are often called water pills because this medication helps the body get rid of water through our kidneys, which causes us to urinate more often. As a result, this medication reduces the amount of work the heart has to do, helps to remove excess fluid that builds up in the body, which can occur if one has congestive heart failure. The common side effects that can occur with these medications include more frequent urination, which may lead to dehydration and muscle cramps. To prevent this, drink more water every day. It is helpful to take these medications in the morning so the frequent urination does not wake you up in the middle of the night if you take it at night. To wrap things up, I'll summarize the most important points from this presentation. The first step is to be aware of heart diseases such as coronary artery disease and congestive heart failure, and what you can do to possibly prevent them from developing. These are both serious conditions that can lead to other diseases and oftentimes death. Changes in diet and exercises are key preventative strategies to reduce your risk of heart disease. Simple changes in your diet that help lower your risk for heart disease include decreasing the amount of saturated fats in your food, alcohol you drink, sodium such as salt and shoyu, and sugar we eat. Also, avoid trans fats. It is also important to exercise, and we should work towards getting 150 minutes of moderate intensity exercise, such as brisk walking or swimming per week. It is important to start small and gradually increase the amount of time that you exercise as you're able and can tolerate. If you smoke and have not been able to quit on your own, ask your doctor or pharmacist about resources and medications that are available to help you quit smoking. There are also medications available to help treat coronary artery disease and congestive heart failure. It is important to work with your doctor to determine which medications are appropriate for you and take your medications as directed. If you have any questions about your medications, please talk to the pharmacist where you pick up your medications from. By implementing these changes, you will lose weight, lower your blood pressure, and bad cholesterol levels to ensure that you have a happy heart to help us have a happy life. We hope you enjoyed this presentation, and mahalo for listening.